These cuts are affecting everybody, not just the young people or the seniors. Everybody will be affected by this in some way or another. If you're caring for young people, if you're caring for your parents or your grandparents, you listen to this video because it's very important. Hi, this is Danny from Mysterious Things, and I'll tell you, it's a mystery to me what Trump is doing with the Medicare and SNAP program. I found a video today from the Food Stamp Now organization, and they are there to help seniors and anyone interested in the information about the government assistance benefits. And I will link their website down below. And we'll take a look at what he has to say.
Now let's talk about Trump's billion-dollar cuts to fund the trillion-dollar tax cuts. Basically, they are making deep cuts into food stamps, into Medicaid, in order to be able to pay for these tax cuts that is skewed primarily to benefit the rich. What do I mean by that? Well, the first idea that is being floated around is the harvest box. If you haven't heard about this, you need to stay for this because this one is a big one. So basically, Trump wants to turn part of the food stamps program into a harvest box where instead of you going to buy food with your own EBT card, they are going to ship you a box of food that the government picks, shelf-stable food. And that is the option that you're going to get.
Okay, so let's talk about this. The government is going to decide what you get to eat. Instead of giving you a little card that you can go down to your local store or farmer's market, they're going to send you a box of canned food. They're going to send you a box of canned green beans. What if you hate green beans? They don't care. You're going to get to eat it. It seems to me that always the very wealthy, or those that aspire to be, or those that have a little bit of money more than the poorest, seem to feel superior. So because you don't have any money, you're not of value. Doesn't matter how you don't have any money. Doesn't matter that Trump just laid you off from your job and you don't have enough money to feed your family. It doesn't matter that your elderly grandparent ran out of their savings to keep them in the nursing home, and so you're taking care of them at home. None of that matters. If you're on government assistance, they feel that they can lord it over you and tell you what you can eat. What are they trying to do? I mean, are they trying to kill you off? You're going to get canned, processed food, which everybody knows is not good for you. Fresh fruits and vegetables is healthy for you. But no. You have to have the canned stuff because you're not valuable enough to have the good food. We're going to keep that to ourselves. What is it with people? You drag people down and then you stomp on them while they're down there. Let's go on and take a look at what else he has to say.
He pitched it. The largest singular cut Trump attempted was to withhold a portion of benefits and instead provide recipients a box of non-perishable food. Under the plan, the government will theoretically buy the boxes at reduced cost compared with sending recipients their full benefit, and then the government will pocket the rest.
So did you hear that? They're going to buy you a box, which means they're going to have to source it. They're going to have to get somebody to deliver it. They're going to take your whole check, take a part out of it to send you how much food they think that you should be able to live on for the month, and they're going to pocket the rest. Good job. You're paying, you know where the rest of that money's going? To pay for that $4.5 trillion tax cut that Trump is trying to get through the Congress, which he will get because, of course, he has the majority. So $4.5 trillion is going to go to billionaires and trillionaires off the backs of our poorest people. It's crazy. Let's see what else he has to say.
So here's how it's going to work. As he did previously, he would take 40% of SNAP benefits issued to households and use half of those funds to give households eligible for SNAP benefits of $90 or more a month a box of non-perishable food. So if you were getting food stamps of more than $90 a month, it's going to take 40% of that and send you a box of non-perishable food such as shelf-stable milk, ready-to-eat cereal, pasta, peanut butter, beans, and canned foods. The box will be in lieu of the food that these households would otherwise purchase with the part of their SNAP benefits in the grocery store. Participants apparently will have no choice in what they receive. The government will pick everything every month and send it to you. The other half, remember, he's thinking 40%, the other half of that money held back will be completely gone. So you're not get that. He's going to take that money and put it back in the government, resulting in about $120 billion in federal cuts over 10 years. This is serious business.
So they're going to raise the level to be elderly from 60 to 65, which means that there's 5 years worth of people that had benefits, but they don't get them. And if you're under 65, you need to be working. Is this what we come to? Forget about how hard it is to get a job when you're over 50. It's almost impossible. Again, those people don't matter because they're poor. And if you're poor, we're just going to take it. I have an idea. Why don't you tax the billionaires who have all the money in the world and are not getting taxed, instead of giving them a tax cut off the backs of the poorest people? Let's go on, see what else he has to say.
This is Glenn Thompson. He's the chairman of the House Agricultural Committee. He's full lock and step with this. He wants to cut $30 billion over 10 years.
When it comes to
part
voting,
of it is what I have shared with you as part of his plan.
Let's vote him out.
So how deep are these cuts going to be? Well, let's look at it. So the House Republicans proposed calls for a $230 billion in cuts to food stamps over a decade through the Agricultural Committee. This represents about 20% reduction in the program's current funding levels and will be the largest cut to food stamps in 30 years.
Have your food costs gone down in the last 30 years?
Think about maybe 20 to 30% of it will be gone. Some of you will lose all of your benefits because they will make the eligibility requirements so hard that it will just knock you off the program. SNAP serves 42 million Americans, 1 in 5 children, and the program is crucial for working families, seniors, and disabled individuals who struggle to afford adequate nutrition. And what is all this for? Well, these cuts are part of the larger $2 trillion in reduction in mandatory spending designed to help House Republicans push through Trump's $4.5 trillion in tax cuts that will primarily benefit the wealthy Americans, requiring a $4 trillion increase in the debt ceiling. So who is going to be impacted by these deep cuts in the food stamps program? Well, over 42.1 million Americans receive SNAP. The program serves 11.6% of children under 5 and 28% of children between ages 5 and 17, making it a crucial part of families' nutrition plan. It cuts across the entire country. So it's going to affect people in Oregon, to New Mexico, to Oklahoma, to Louisiana, to Illinois, to West Virginia, to Washington, D.C. So this is not specifically to any particular region. It's going to affect SNAP beneficiaries and seniors across the country.
We also need to consider the effects that this is going to have on our farmers. Our small farmers produce the foods that we buy with these in our local market. And they're taking away their customers and giving it to the big agricorps, of course, because they process lots of food. They do everything from planting to growing to canning to getting it on the shelves. So, yeah, they can produce it cheaper. Doesn't mean it's better for you. Just means the corporations make more money and the small farmers go out of business. You small farmers out there, did you vote for this? Wow. So let me know in the comments what you think about this. Are you getting SNAP benefits or Medicare? Were you low income food benefits? Does your child get them at school so that they can have a free meal at school in the morning when they get there, or maybe lunch? How is this going to affect you? And if you're one of the people that's not getting them, how do you justify taking food from the babies to give to the richest people in this country? I'd like to know. If you can tell me how you justify it, I have no words. I have no words. I have no words for how it could be justified. But maybe somebody can really tell me how this is going to work and be better for everybody. Okay, let's go on and see what else he has to say.
March 27th, they're going to vote on this. It's going to come to the floor probably in the end of February.
So, what can you do? Well, you can contact your representatives. They are going to be voting on this the end of March. So now's the time to get hold of your representatives. Now you can download, I've put a link down below where you can download, it's called 5 Calls. And that's how you can share your concerns with your congressional representatives through these calls. The best thing to do is go to your local office or go to a town hall meeting if they have one in your area. That's great. But if you can't, do the call. I guess I've heard that the emails, when you send emails, they just basically throw them in the trash. But they can't ignore your calls. Tell them your personal story about how SNAP is important to you. And that can be really influencing. You can share some of your stories down below too, and maybe I can help as I call I can say, look, I just heard from one of the people on my channel that this is happening. They're going to be cut off from their food stamps and they're not going to be able to feed their family. The next thing you can do is stay informed. Monitor the news about this budget resolution and respond as quickly as you can when you hear news about changes or things that are going on, timelines, right? Get some community support. Local food banks and advocacy organizations, they need volunteers and resources to prepare for the increased demand if they're the ones that are going to be handing out these food boxes. These organizations provide opportunities to help families in need. If they do get cut, volunteer your time, volunteer some cash to help these people out because it's going to be serious. Now, with all of these claims, there's always some fraudsters out there that are going to try to be taking advantage of you. So verify any claims that come out about SNAP changes and do it through the official sources and reputable news outlets, okay? Accurate information is what helps communities prepare for the changes, okay? Another part of this is Sarah Huckabee. Remember the communications director for the White House and now governor of Arkansas? She has written a letter to the U.S. Department of Agriculture's Food and Nutrition Service, and she's requesting that there should be limits on the SNAP purchases. The limit is to restrict junk food purchases. So, again, some wealthy people are going to get to decide what you eat. Maybe you need to have that candy bar just for your mental health. Nope, can't buy it with SNAP. I am totally against someone else deciding what I can eat. If I have a food restriction allergy and you send me a jar of peanut butter, are you trying to kill me? And you know how they're going to label this? They're going to label it, Make America Healthy Again. Sarah Huckabee needs to take some of her own advice. Another thing that's going to happen is the work requirements. If you're age 16 to 50 and able to work, you will probably need to meet the general work requirements to get SNAP. You have to register for work. You have to participate in a SNAP employment and training work fair thing. If assigned to your state SNAP agency, you have to take the job if it's offered, and you can't voluntarily quit that job or reduce your work hours below 30 hours a week without good reason. Not to mention that they can, a lot of these low-paying jobs at Walmart and Safeway and all those big corporations, they work you under 30 hours a week because they don't want to have to pay the extra taxes on you. So you're a part-time employee, which means you're a part-time employee making minimum wage, and you can't get SNAP benefits because you're not making the 30-hour-a-week bar. The other thing is if you're taking care of a child under 6 or you're taking care of an incapacitated person, you won't be kicked off SNAP. If you're unable to work due to a mental or physical limitation, or if you're participating regularly in a drug program or alcohol program, or if you're studying in school or a training program at least half the time, there's some different rules for college students in there too. So it's not as straightforward as it sounds. Now let's look at the cuts they want to make to Medicaid.
What is the scale of these cuts? Well, the House Republicans have unveiled a proposal to cut $880 billion from the Medicaid program over a decade. This is going to really be a deep cut. The cuts are being proposed to help finance Trump's tax cut package, estimated to cost between $5 to $11 trillion over 10 years. Medicaid currently provides health insurance to about 80 million Americans, including children, elderly and disabled, and low-income adults. The program costs approximately $870 billion in 2023, making it the primary target of deficit hawks.
They are proposing an $880 billion cut to a program that costs $870 billion, basically eliminating the entire program. The cuts, how are they going to affect you? Well, if you live in a rural area, like I do, my nearest hospital is 30 miles away and in jeopardy of having to close because there are a lot of elderly people in this area that will not be getting their Medicare. And the hospitals are a business. I mean, they're trying to make money and pay their doctors, and it takes forever to get in to see a doctor. You never see a doctor. You see a physician's assistant or a nurse or something. So these little hospitals will close all around the country. Doesn't matter to these billionaires. They have plenty of money to go to the doctor. They can buy their doctor and have them follow them around. This doesn't matter to the senators and congressmen because they have their own private health insurance. They should have to have the same health insurance that we have, but they don't. Ask them to take a cut in their health insurance. That's not on the chopping block. It's only the poorest people, the poorest areas that they want to cut. I don't understand people like this. I just don't understand.
So what are the proposed cuts that they want to do? The first one is work requirements. Republicans are considering nationwide work requirements that will cost $109 billion, that will save $109 billion, but will cause approximately 1.5 million people to lose their Medicaid coverage. The requirements will primarily affect working age adults who aren't disabled or caring for young children. So this is going to include seniors. A proposal to limit federal funding based on population will save up to $900 billion over 10 years. This will fundamentally change how Medicaid is funded, ending the current federal matching system.
The requirements would primarily affect working age adults who aren't disabled or caring for young children. So what is working age? Any age? Or is it that same 65-year requirement? I'll have to look into that.
So why should seniors care? Well, Medicaid is a joint program between the states and the federal government that provides health care to low-income Americans, including seniors, disabled individuals, and children, and working families. Unlike Medicare, which is purely federal and primarily for seniors, Medicaid covers a broad range of services, including long-term care and nursing home coverage that Medicare doesn't provide. That's why seniors need to care about this news. Currently, Medicaid serves approximately 80 billion Americans and costs $870 billion annually. Medicaid pays for essential services, including nursing home care, health, home health aides, personal care services, and medical equipment that many seniors rely on daily. For many middle-class families, Medicaid becomes the crucial angle, the crucial health provider when their savings are depleted by long-term care costs that Medicare won't cover.
Okay, let me give you a personal story. This is how this would have affected me. My husband was, for 2 years, bedridden in my home. We couldn't afford to send him to a nursing home. We couldn't afford a hospital bed for him. Medicaid took care of that for us. It was $200 a month that we just couldn't. We were strapped for all kinds of different reasons. But the extra $200 a month, it paid for, and it also paid for some home care health. They didn't do much. But, they would come a couple times a week to help me give him a bath and things like that. But I did 24-hour care for 2 years for my husband until he passed away. And I would have had, I don't know, he couldn't sleep in a regular bed because he'd lost all ability to take care of himself. So he couldn't go to the bathroom. He couldn't get up and walk. I couldn't lift him into the wheelchair. So he was basically bedridden. And if we didn't have that bed, I don't know what. Maybe I could have put him on a cot in the living room. I don't know. But that's how it affects you. These people have no idea. Oh, I'm sorry. Okay, let's go on.
So why should it matter for seniors? Well, long-term care, that's why you should care about Medicaid. Medicaid is the primary payer of long-term care in America, covering 62% of all nursing home residents and being the only program that covers extended nursing home stay. Without Medicaid, middle-class seniors will be unable to afford nursing home care, which will cost about $90,000 a year. Another reason why seniors should care: home and community services. Medicaid provides crucial support that allows seniors to remain in their home through home healthcare services, personal care assistance, and medical equipment. These services help seniors avoid delay or expensive nursing home care while maintaining independence in their communities. Family care support. If you have a family member giving you care, that could be paid through Medicaid. Medicaid helps support family caregivers through programs that can pay family members to provide care through respite care services. This support is vital for millions of families struggling to care for elderly parents while maintaining their own jobs and families. And then health safety nets for seniors who have exhausted their savings for paying for health care or never had significant savings. Medicare services serves as a crucial safety net, ensuring access to necessary medical care. The program often becomes essential when seniors face unexpected health crises or when chronic conditions require extended care. It doesn't matter which party you're in, you know somebody who is on Medicaid or gets assistance from Medicaid, especially seniors and people who are disabled.
Well, let me know what you think about these cuts, this SNAP into Medicare. I think it's inhuman. We are the richest, or maybe one of the richest countries in this world, and we can't care for our children and our elderly. It's horrible, it's embarrassing, and it's inhuman. And it's a mystery how people lose their humanity as they climb the economic ladder. They got theirs, so why think about anyone that wasn't able to do that for a lot of reasons? So let me know what you think in the comments below. I will see you next time with some more information about the mysterious goings on in our government and the effects that they're having on real people.